In recent years, we have seen a rise in devastating wildfires, with a concurrent rise in the physical, emotional, and economic toll on our society. The latest wildfires that have spread over 9 out of 13 of Canada's provinces have followed after record heat and drought over the past year. According to the Canadian government, parts of its Atlantic region, including Nova Scotia, New Brunswick, Prince Edward Island, and Newfoundland, recorded their driest April on record. And with the hottest and driest period of the year still to come, the country is anticipating its worst ever wildfire season. According to the World Health Organization, between 1998 and 2017, wildfires and volcanic activity affected 6.2 million people worldwide. Further, a study published in the Lancet Planetary Health estimated deaths associated with pollution from wildfires around the world. They specifically looked at PM 2.5, particulate matter less than 2.5 microns in diameter. We see PM 2.5 referenced a lot in the research because it is a major component of smoke and is often used as a proxy for more complex wildfire smoke mixtures. Using PM 2.5, the study found that over 400,000 deaths annually could be attributed to just the acute impacts of wildfire-related pollution. Moreover, with climate change driving more extreme weather patterns, the size and frequency of wildfires are growing. We need to better understand not only the short-term, but the potential long-term impacts that these disasters can have on our health. For this reason, researchers have been increasingly investigating the health consequences of wildfires. Studies conducted in Brazil, Colorado, and California on wildfire exposure during pregnancy revealed several effects on newborns. These studies showed that infants exposed to wildfire smoke in utero had slightly decreased birth weight and a greater chance of being born preterm. These conditions are known to be associated with complications, such as blindness, deafness, learning disabilities, and sudden infant death syndrome. Recent studies have also highlighted how wildfire smoke impacts chronic disease. In an in-depth article in Circulation, a journal of the American Heart Association, researchers outlined how wildfires impact cardiovascular health through several pathways. When you inhale wildfire smoke, pollutants such as PM 2.5 deposit in tiny sacs in your lungs called alveoli. As they travel, they damage your cells and trigger a series of effects, including increased inflammation and oxidative stress, which is linked to the development of fatty plaques causing coronary heart disease, impaired dilation of blood vessels causing spikes in blood pressure, increased coagulability, which makes you more likely to develop clots and experience stroke, heart attack, and otherwise cut off blood flow in various organs. A population-based study in Canada looked at visits to the doctor before and after wildfires. They found an increase in visits for health problems related to respiratory disease, with a 55% increase in relative risk for each 10 microgram per meter cubed increase in PM 2.5 levels. Rates of visits for ischemic heart disease also increased by 19%, and individuals with pre-existing diabetes had increased visits for both respiratory and cardiovascular problems. Children under 10 had a particularly heightened risk, experiencing a 111% increase in visits for asthma, acute bronchitis, and acute respiratory infection. There is now also increasing evidence linking wildfires to cancer risk. In Brazil, an analysis of nationwide cancer death records from 2010 to 2016 looked at long-term exposure to wildfire-related PM 2.5. They discovered a higher relative risk of cancer deaths for skin, breast, prostate, testicular cancer, and numerous gastrointestinal cancers. Similarly, a study in Canada assessing long-term exposure to wildfires in over 2 million people found wildfires to be associated with higher rates of lung and brain cancer. There are a couple things that we need to do given the reality of wildfires in today's society. Number one is prevention. As a collective, we need to more aggressively tackle climate change to prevent the extreme heat and drought that leads to wildfires. Stop expanding building into areas that are known high wildfire risk, and implement preventive wildfire management practices, including allowing small burns in unpopulated areas and clearing away kindling that can spark fires. Number two is preparation. We need to have wildfire smoke preparedness plans in place at the community, healthcare system, and individual level. This includes identifying community clean air shelters, ensuring adequate supplies for prolonged indoor periods, including food, medication, and hygiene supplies, employing air filtration such as HVAC systems, and wearing a well-fitting N95 or KF94 mask when exposed to smoky conditions. As we face more frequent and intense wildfires in the future, it becomes crucial to fight the root causes of these fires, understand how they may impact us, and employ strategies individually and as a society to prevent their dangers to our health.